Hello, I'm Rosemary Smith, owner of Weir Comfees. My co-host was Kathy Mutch, um, and a more in-depth introduction about Kathy will follow. If you should know anything about Weir Comfees, it is that we're all about image. Your self-image is important. When you feel good about yourself, you are more confident. This is the reason I do what I do. This is making clothing and accessories for those with an ostomy. An important part of this philosophy is providing you with information about parastomal hernias and support belts. This is the reason we decided to have this educational webinar. Okay, let's get started. Confidentiality. We at Weir Comfees will never sell, give, or rent any of your personal information. If you sign up to receive emails, blasts, newsletters, and etc., you may at any time unsubscribe. Weir Comfees customers' credit cards are always destroyed after the sale is completed. We don't like to keep them, then they can't get in the hands of the wrong people. Weir Comfees. We're a Canadian company. I am the owner and operator, Rosemary Smith. I've been in this business for 13 years, and we make special clothing, panties and casual pants. All the underwear has an inside pocket for the pouch. And the accessories include our waterproof pouch pocket, our apron for use in the shower, and our comfy drive to use in your vehicle when driving to protect your stoma from the seatbelt. And Parastomal Hernia Supports. More about them now. A little more about me. Creative, love sewing, and developing new products. I'm a problem solver. I believe there's always a solution. I have had 30 plus years in corporate human resources. I'm married with 3 adult children and 6 grandchildren. I'm servant to 4 cats that live with me. This is my retirement and I'm having a great time. Kathy Mutch, who helped me put this webinar together, is a certified enterostomal therapy nurse at the Queen Elizabeth Hospital in Charlottetown, Prince Edward Island. She has 30 years experience in enterostomal therapy nursing. She is a member of the CAET, and she is also the regional director for the Atlantic provinces. Recently, on parastomal hernias, she spoke at the Canadian National Conference at the CATs. As an independent enterostomal therapy nurse, she doesn't endorse any one product, brand, or manufacturer, and there are a number of manufacturers who make abdominal support belts and parastomal hernia belts. When fitting patients for these products, she will always inform them of the various selection options. Our goal here is to provide useful information about the prevention and management of parastomal hernia following ostomy surgery. The agenda today is to tell you about the different kinds of ostomies, to explain what a parastomal hernia is, and how often it occurs. What are the risk factors for getting a parastomal hernia? How can the risk of developing a parastomal hernia be reduced? How can a parastomal hernia be managed? A definition: an ostomy is a surgically created opening for the discharge of body waste. Depending on the body part used to create the ostomy, it will be referred to as a colostomy, ileostomy, or urostomy. The bowel or ureter is brought up to the surface of the skin, sutured, and then it grafts in place. A stoma is a visible part of the ostomy, usually made of a loop of bowel or ureter. It is red, moist, and has little feelings. Parastomal refers to the area around the stoma. The colostomy is a surgically created opening into the colon, diverting stool from its normal route. Medical conditions that may require bypassing or removing parts of the colon include diverticulitis, cancer, trauma, Crohn's disease, or birth defects. A colostomy may be temporary or permanent. The ileostomy, a surgically created opening into the ileum or small intestine, diverts stool from its normal route. Medical conditions that may result in an ileostomy include inflammatory bowel disease, cancer, trauma, familial I can't say that, birth defects. An ileostomy may be temporary or permanent. Urostomy, a surgically created opening to divert urine when the bladder must be bypassed or moved. The most common type of urostomy is called ileal conduit. Medical conditions that may result in urostomy are cancer, diseases or injuries that result in loss of bladder control, usually permanent. The parastomal hernia presents as bulging around the stoma. It is caused by the passage of one or more loops of bowel between the muscles surrounding the stoma and the stoma by the loop of the bowel that makes the stoma. Common problems following ostomy surgery may be distressing emotionally, may create challenges when applying your pouching system, may contribute to additional costs, need for additional supplies and/or specialty equipment. The incidence of parastomal hernias, as reported, varies greatly in the research, and it may be up to 78% of those with an ostomy, according to the Equina report in 2014. The risk factors, characteristics of the person with an ostomy, and surgical technique. For the person, obesity and larger waist circumference, a female, age over 60 years, low protein levels at time of surgery, or chronic cough. Surgical risk factors would be the siting of the stoma, where it's located on the abdomen, an opening size of the muscle for the stoma to pass. The prevention program by Thompson and Trainer. They're an Irish firm. Their year one was done in year retrospective. There were 28% of people with an ostomy had a parastomal hernia, but they hadn't started the program. Year two, the first year of the program, 14%. So that was a drop in half. Year three, the second year of the program, it was 17%, and they think that some people may not have continued to do the program. The prevention program is patients' awareness of the risk of developing a parastomal hernia, abdominal exercises, maintaining good posture at all times, maintain weight at 20 to 25 BMI, no lifting for 3 months after surgery, none whatsoever, use of an abdominal support belt while lifting after 3 months and for the first year after surgery. The principles of the exercise is always check with your surgeon or ostomy nurse before starting any exercise program. Strong muscles help to minimize the risk of parastomal hernias. Exercises like swimming, walking, cycling. The following exercises have been shown to be helpful. These exercises may be started after the abdominal wound has healed. Check with your surgeon or ostomy nurse. Pelvic tilting. Lie on your back on a firm surface with knees bent and feet flat on the bed. Pull your tummy in, tilt your bottom upwards slightly whilst pressing the middle of your back into the bed and hold for 2 seconds. Let go slowly. Repeat 10 times daily. Knee rolling. Lie on your back on a firm surface with knees bent and feet flat on the bed. Pull your tummy in and keep your knees together. Slowly roll from side to side. Repeat 10 times. Abdominal sit-ups. Lie on your back on a firm surface with knees bent and feet flat on the bed. Place your hands on the front of your thighs and pull your tummy in. Lift your head off the pillow. Hold for 3 seconds, then slowly return to starting position. Repeat 10 times daily. Parastomal hernia management is often done through the use of girdles, binders, or specialized parastomal hernia belts. If your surgeon determines surgery would be helpful, it usually means an operation to open the abdomen, repair the hernia, and place a mesh to support the bowel and prevent further herniation. Rare complications of a parastomal hernia can occur. This may result in the need for urgent surgery. Support belt. It is an elastic belt that goes around the abdomen, covers the ostomy, and has a Velcro closure. Weir Comfees belts do not have Weir Comfees belts do have an opening for the pouch to be pulled through. Some belts do not have an opening for the pouching system. The belt is to be worn whenever you are doing any lifting, 3 months after surgery and for the first year. Now, no lifting before 3 months. The parastomal hernia belt is an elastic belt that goes around the abdomen, usually has a Velcro closure. The belt may or may not have an opening for the pouching system. The belt may be worn during the day or whenever you are doing any lifting. How to correctly measure for the PSH belt. Whenever possible, this measurement should be done by a trained professional or fitter. Find an interstomal therapy nurse at the Canadian Association of Interstomal Therapy, and this is their website. Or for the US, go to www.wocn.org, then scroll down the left side menu to patient information, and it's the first on the list, how to find an ostomy nurse. Now, here how to correctly measure for the parastomal belt. As there are situations when this is not possible, the following explains how you can measure for a Weir Comfees belt. You may still need the assistance of a spouse, partner, friend to help with the measuring. Okay, to measure the length of a support belt, put a measuring tape across the bed and lie down on top of the tape, placing it at the level of the stoma. Allow the bulge to flatten. This may take a few minutes. Now measure around your torso just above or below the stoma, just so you're not including the stoma because that might make the belt too loose. Okay, now the width of the belt. Remain lying down. Measure from the top of the hernia or bulging area to the bottom of the hernia. If it's less than 6 inches, then you would know a 6-inch belt would be sufficient. If it was larger, you may have to go to a 7, 8, or 9-inch belt. To measure for the pouch, provide the manufacturer's name and product number of your pouching system. Could be your flange or your pouch, and we can determine how big the opening needs to be, because it needs to fit fairly snug, but your pouch has to lie flat. It looks better. Okay, when you get the belt, you place the support belt under you on the bed, Lie down on top of the support belt until the hernia or bulge flattens. Put your pouch through the opening. Fasten the support belt. Now sit or stand up. And these are all the references of where the information was obtained about the exercises and the incidents. This information is contained in this educational webinar does not replace information or advice provided by your medical professional. This has been part of a series of educational webinars for those with an ostomy or for those that care for people with an ostomy. Weir Comfees will provide those on our newsletter mailing list with a link so they may share this important information with family, friends, coworkers, etc. If you haven't signed up, please go to www.weircomfees.com and do so. Thank you. Our next planned webinar will be in September 2015. The subject will be intimacy. If you have a suggestion for future topics for any of our upcoming educational webinars, please send us an email to service@weircomfees.com. Thank you.